Hello friends, hope you're all okay. You're all enjoying your life. You're also enjoying my videos. Welcome back to Dr. Arshad Nadeem Ultrasound teaching videos. Today my topic of discussion is pregnancy associated ovarian syndrome. Pregnancy associated ovarian syndromes are multiple. There are particular names for all that, like hyperstimulating ovarian syndrome or ovarian stimulated syndrome. There are other some other names being given by the authors. So how these will appear on the ultrasound imaging, how we will pick the point, and how we will label all these names. So this video will include all these information. So let's start watching these images and you will be able to pick the points related to pregnancy associated ovarian syndrome. Ovarian lesions associated with pregnancy include hyperstimulating ovaries or ovarian stimulation syndromes, and very rarely luteoma of the pregnancy. Most are related to the normal or abnormal response to serum HCG level, human gonadotrophin level. Hyperstimulated ovaries are a normal response to elevated circulated level of HCG. Ovarian stimulation is most commonly in women undergoing ovulation induction. On the ultrasound, the ovaries are enlarged with multiple cysts, some of which may be hemorrhagic. The enlarged ovaries may be undergone torsion. They usually regress spontaneously during the pregnancy. Mild degree ovarian hyperstimulation syndrome would be considered when ovarian size is less than 5 centimeter. So that would be a mild degree. In moderate degree, the ovarian size would reach up to 12 centimeter, and that would be called as moderate degree. And if the ovaries are enlarged or greater than 12 centimeter, that would be the severe form of ovarian hyperstimulating syndrome. As you can see on this slide, ovaries are enlarged that are greater than 12 centimeter. So it's a severe form. Beside this, multiple follicles can be seen in the ovary, some of them having a low level internal echo, which suggests these are hemorrhagic contents, and some of them having a fine granulation or reticular pattern. Some of them are having small septation or thin septations. Serum HCG level was increased, and beside this you can see edematous status of the ovary as well. So ovaries enlarged, multiple follicular cysts are there, some of them are hemorrhagic cysts. So this is classical example of ovarian stimulating syndrome. Well, the image of this patient has ovarian hyperstimulating syndrome, and as I mentioned earlier, that the term ovarian hyperstimulation syndrome is used when the hyperstimulation is accompanied by the fluid shift. Ovarian clinically, there are three categories of ovarian moderate stimulation syndrome. They will be described as more than 12 centimeter in moderate form. There will be fluid imbalance. There will be electrolyte imbalance, and there will also be fluid within the peritoneal cavity, which may usually resolve within 2 to 3 weeks. But during the scanning, you will see a lot of fluids in the abdominal cavity. Here on this image, you can see that the surrounding liver area shows fluid and fluid accumulation. Beside this, secondary to the fluid, gallbladder wall appears also thickened. So this is the example of ovarian hyperstimulating syndrome, moderate and severe degree. So whenever you look for the ovaries, always concentrate on the ascites. There will be ascites. Look around the perihepatic area, in the Morrison pouch, and around the kidneys area as well. Surface epithelial inclusion cysts are non-functional cysts, usually seen in post-menopausal women, although they may be seen at any age and are usually located in periphery of the cortex of the ovaries. They arise from cortical invagination of the ovarian surface epithelium. That's why it is called as surface epithelial inclusion cysts. When these are very small, the cysts themselves may not be seen, but rather they may appear as punctate echogenicity in the surface of the ovaries. Although usually tiny, unilocular and thin-walled, these cysts can measure up to several centimeters in diameter. Occasionally, surface epithelial inclusion cysts may be hemorrhagic, particularly if torsions has occurred. This is a transvaginal image and it shows a multilocular cyst with linear septations attached to the right ovary that project within the structure and contain a hemorrhagic cyst. It is clearly visualized that this is the right sided ovary and it contains hemorrhagic cyst. You can appreciate small tiny reticular pattern within the cystic lesion. This represents adhesions attached to the right ovary. In the surrounding area you can see thick septation, there is septations, so these septations are suggestive of adhesion pattern. So quite often you will come across these type of structures, these type of ovarian structures in postmenopausal women, but the patient will usually complain of severe pain, lower abdominal pain and tenderness. And when you scan the patient, concentrate on the ovaries, and surrounding the ovary there will be adhesion, and within the ovary there will be cystic components as well. So this would be labeled as surface epithelial inclusion cysts. Yes, friend, this was all about the pregnancy associated ovarian syndrome. Hope there will be no doubt left and you will be able to pick all these points and you will be able to use this terminology quite confidently on your report. With some other informative videos, we'll see each other. Till then, take great care of yourself. See you then. Bye bye.